Well, here we go, because employers are either imposing or lifting mandates, COVID vaccine mandates. Starbucks announced last week that they would no longer require vaccination for employees, while other large companies are going forward with mandates. Paul Seegert is with PCS Advisors. It's a benefits consulting firm based in Northern California, and he says a lot has changed since they surveyed their clients early last year.
85% of employers told us they would have a policy in place by the end of 2021. That was large employers and even small employers that were saying that. Only 18% of employers ended up actually having a policy in place by the end of 21. And then the balance either aren't going to do it or we're waiting on the OSHA ruling. We're at a place where maybe 25% will end up doing it. We're seeing headlines about the bigger employers that you mentioned that are saying, hey, we're putting that on hold. We're not doing it.
For those going forward, and particularly in healthcare, the results of mandates have been devastating. 1 in 4 hospitals in the country now has a critical staffing shortage. Seegert says hospitals are trying to put the best face on mandates, but the number of those resigning or switching careers is stark.
A lot of the CEOs, and that's a pretty political job to have come out. Mayo Clinic a couple weeks back as an example and said, hey, 99% of our workforce complied and we only had to fire 1%. And they fired 700 out of their 70,000. The part of the story they're not sharing, and I think there's political pressure and reasons why they're not, is the fact that they did have a lot of folks that left their jobs prior to getting fired, nurses that chose to retire early. And so 500,000 nurses are leaving the workforce as we speak, and we're on track to have a shortage this year of 1.1 million nurses, just looking at nurses as a subset within healthcare.
Going forward, Seegert says he expects about 25% of private companies will have some kind of mandate. But the conversation surrounding mandates is changing due to new science on natural immunity, waning cases, and growing public distrust of health agencies.
Companies have pretty well staked their positions. We're going to see not too many more are going to add onto the side of putting in mandates. I think we will see it wane. There's not only the fact that the OSHA mandate didn't survive, I think that contributes to that, but also the overall lack of credibility now that the CDC, our various organizations at a government level, at a national level that have led us through our response to this, they're at an all-time low in confidence, whether that's the FDA, the CDC, the NIH, because there's been so much conflicting information, and evolving science doesn't explain it. The fact that which I think also contributes to the conversation we're having about the mandate. You don't have to be a scientist to be able to see that there are now more than 90 studies that confirm natural immunity is a real thing, and yet it doesn't get discussed.
Seegert has been watching a bill going through the legislature that would provide state care to all Californians. That bill has been endorsed by California's largest nurses association. We're going to talk about we have talked about the taxation piece of that bill. But he's going to weigh in more on the actual care it would entail. So it's a separate topic that we wanted to discuss with him. We're going to hear more from him on what California would look like under that single payer system tomorrow.
And he brings up a good point about natural immunity and how that hasn't really been much a part of the conversation.
No, it really hasn't been. I mean, other countries are considering it, but so far in this country, we haven't really talked about it a lot or have considered it as a mitigating factor in getting the coronavirus under control.
Okay. Yeah.